Hey guys, it's Dr. James Kennedy, Texas Foot and Ankle Centers. We've decided we're going to start a new segment here, and we have a lot of what we call durable medical equipment products. And what they are, they help your feet from having so much pain. And you know, about 65% of my practice is dealing with arthritis. And I have a lot of patients who are getting to the point where they're starting to develop some bone spurs. And people ask me, is there anything that I can do that's non-surgical that can help me with my feet and decrease some of my pain? And here's what I have today. This is a small gel pad. It's made by this company right here, but what you do, you actually put it on a toe. And usually on these smaller ones like this, they make various sizes and various lengths, but you can put this small gel pad next to a small bone spur around a toe. Okay, and what this is, it's got a little bit of padding to it, and the person can put it around their toe and decrease some of the pain. So if you're looking at these foot models, I love these foot models. I have these in every single one of my rooms, and the reason why is because it can show anybody the difference between a person who is 17 years old and has a perfect looking foot with no types of bone spurs or bunions or any type of what we call mid-tarsal exostosis or bone spurs here. And then as we mature in age, we go from a 17-year-old foot to a 95-year-old foot, where you start to have bone spurs here, bone spurs around the toes, right in here, bunions, what we call mid-tarsal joint, bone spurs here, and small bone spurs around the heel. So if you're looking at these two foot models, you can see that these toes are perfectly looking straight, and they don't have any type of bone spurs. And as we mature in age, what happens, we start to develop bone spurs here and here. This is a perfect example of a bone spur. These two can rub against these toes just like this, and when that happens, you can develop a small callus like this or this. So what I tell the patient to do is actually slip this over, and it's got a gel pad underneath it right here, and slip that over the toe in this area directly on it there, and it can decrease some of the pain. Now, I actually remove bone spurs minimally invasive with small incisions on here, but if I can keep patients from having a surgery, that makes me a lot happier, and I think it makes the patients a lot happier too. So I'm more than happy to do a small bone spur surgery on a person that needs it. But one of the philosophies that I have is I try to get you out of this office without doing a surgery. Surgery is always the last option. So if you're looking at these foot models, and you got these small bone spurs, a small little slip-o pad like this would help really well. And what I like about these is I tell my patients to have a sock, have a small little sock. When this gets dirty, stick it inside the sock, tie a knot in it, and then throw it in your washing machine. And then after that, you can wash these over and over again. And sometimes they last a couple of years, but we actually sell these here at the office. And if it can keep a person from having a surgery, it makes me really happy. Thanks, guys. Bye-bye. Have a good day.